Oxidase test. So this test is used to differentiate bacteria that produce enzyme cytochrome C from those that don't produce this enzyme. The principle for this test is that if an organism which produces this enzyme, cytochrome C, is brought in contact with the oxidase reagent, phenylene diamine, it will oxidize the reagent and it will result in the production of deep purple color. The procedure: first of all, we need a filter paper, a petri dish, the freshly prepared reagent, and wooden sticks or the glass rod, and the colony in the culture plate. So first of all, place the piece of filter paper in the petri dish and add 2 to 3 drops of freshly prepared reagent onto the filter paper. Then, using a sterile wooden stick or glass rod, we are going to scrape off the colony from the culture plate of the test organisms, and we are going to rub it onto the filter paper which already has the reagent. And now we are going to look for the development of purple color within 10 seconds. If you see purple color appearing, that means the test is positive, and if there is no appearance of purple color, the test is negative. Purple color within 10 seconds is positive, while no purple color within 10 seconds is negative. Examples include Pseudomonas, Vibrio, Neisseria, and E. coli Enterobacteriaceae are negative. So the precautions that we need to take out to perform this test are very important. First of all, we should not use loop wire to transfer the culture, because the oxidase reagent can react with the iron and it can give false results. Now we have to observe the result within 10 seconds, because if we prolong it, the atmospheric oxygen may react with the reagent and it can also give false positive results. And the culture should not be 24 hours old. Okay, the last one is bile solubility test. Now, this test is used to differentiate those bacteria that are soluble in bile and bile salts, such as alpha hemolytic strep pneumoniae, from non-soluble alpha hemolytic strep viridans. So those bacteria, especially alpha hemolytic strep pneumoniae, which is soluble in the bile salts, can be differentiated from the alpha hemolytic strep viridans, which is non-soluble. Now, the principle of this test is that the bile salts, the reagent actually activates amidase enzyme of the pneumococci that results in its lysis. That means autolysis of the bacterial colonies. Okay, the procedure, we have two types of methods here: direct method and the tube method. So in direct method, we are going to first of all, we need the culture plate that has the colonies grown in it, the suspected colony of alpha hemolytic strep pneumoniae, as we mark it A here, and any other colony, be it an alpha hemolytic strep viridans colony, this one here. So after taking the culture plate, we are going to add 2 loops of reagent, 2% bile solution on the suspected alpha hemolytic colony directly onto the culture plate, and here again. And then we're going to incubate it for 30 minutes at about 37 degrees Celsius, and after that 30 minutes we're going to examine for lysis or disappearance of the colony on the plate. So as you can see here on this plate, this was alpha hemolytic strep pneumoniae, while this was some other strep viridans. So here that you can see that there is no colony visible. That means the colony has been lysed and disappeared. So that test is supposed to be positive. While here we still see some colonies, that means that bacteria wasn't lysed and there's no disappearance. So that means the test is negative. Okay, now the second method is tube method. We require a test tube which already has 2 ml of normal saline in it, and then we're going to take several colonies of test organism in a tube with that in the same tube that already has 2 ml of normal saline, and when we are going to mix it well, and it will form a turbid suspension. Now we are going to divide this turbid suspension into 2 tubes, the tube 1, which is marked or labeled as test tube or test organism tube, and the tube 2, which is termed or marked as positive control. Now in the test organism tube, we are going to put 2 drops of the solubility reagent, and we are going to not add anything in the control tube, and then we're going to incubate both tubes at 37 degrees Celsius for 10 to 15 minutes. After that, we're going to look for the results. The results show that if there is clearing of the turbidity, the turbid solution we already prepared, if there is clearing of the turbidity, that means the test is positive, because clearing means that the bacteria was lysed and disappeared. So that means Strep pneumoniae is lysed by bile and the test is positive. While if the turbidity is still seen and there is no clearing, that means it is negative and it can be Strep viridans. So positive control is positive for Strep pneumoniae, while negative control is Strep viridans. So that was all about bench test. You are required to write the text as well as draw the diagrams mentioned here along with those practicals as well. Thank you.